Hello and welcome to another episode of Plastic Surgery Unfiltered, a podcast at the intersection of healthcare, business, and the beauty industry. I'm your host, Dr. Armando Davila, and joined by my co-host, Kristen Rosati. How are you doing today?
I'm doing well, thanks.
We're really off the cuff today on the system isn't built for your best life. The topic is all about, we're going to be the business of peptides, but the way I'd like to think about it is, that healthcare isn't designed for you to be at your best. It's designed to bring you back when something goes wrong. Mm-hmm. I'll start with a little story. I'm a plastic surgeon, for everyone who doesn't know. And I was watching a video of a surgeon, a plastic surgeon, wanting to get a pre-authorization for a procedure known as lymphovenous bypass. Mm-hmm. And lymphovenous bypass is a microsurgical technique. I've trained in microsurgery. I've done this before. And it is a preventative procedure. So you have breast cancer. You have more advanced stages of breast cancer. You're going to get your axillary nodes removed. You're going to get radiated after that to control local disease. And your risk of lymphedema in that extremity is like 40%, 50%, which is, and I think you've seen patients probably with lymphedema. It is a life-altering disease. It is essentially unfixable once it happens, and you will spend the rest of your life managing it, paying for things, paying for garments, procedures, therapy, all this sort of stuff, and it will never be normal. And lymphovenous bypass is a very easy, relatively easy procedure that can be performed at the time of the axillary node dissection to just connect up some of the lymph nodes, and it will reduce the chances of having lymphedema from like 40-50% to like 10% or less. And there's data that shows this. But because it's about keeping you healthy and not treating disease, the insurance company didn't want to cover it. And this is really the crux of the issue, right? That we have people, doctors, who are providers. They provide a service, like your lawyers, like your accountants, like your all this sort of stuff. And in every other system, they provide that service. Then there's a payment that occurs for that service. And we've inserted this third party, this third thing that gets to decide really who the services are for and are not for. And they don't really provide a service to either party, but they exist. And their existence is dependent on you being sick, right? Which is why, no one can convince 20-year-olds to, buy health insurance, right? Because they're not sick. So why would I get it, right? Because it ultimately doesn't keep you healthy. And I think this is important because we just spent 2 episodes talking about peptides and the craze behind peptides. And so, Kristen, the question I have for you is, how do we keep people healthy? What do we need to do to keep people healthy? And why is it sprouted out this whole wellness industry? And why isn't it just called healthcare?
I think that the masses are reaching a very similar conclusion, right? And people are frustrated. People who are insured are still also paying a lot of money for their services, even despite having health insurance, right? So people are frustrated. I'm frustrated too. But I listen to a podcast on peptides too. Okay. A wonderful podcast. But it kind of touched on this, staying healthy before you get sick, right? How to keep yourself healthy. And I didn't know this, and I was anti-peptide, so I did a little bit of research on it. But there were peptides that were FDA approved. They weren't patentable, right, because they're biologic. And so drug companies can't capitalize on those necessarily, right? So then in 2023, I think, were withdrawn from the market and or from FDA approval, and they're supposed to go back up. But I think it's really opened my eyes to the things that we can do for patients to help keep them healthy and prepare for surgery and better outcomes. I think about prejuvenation for our patients, right? And so the whole concept to me is new, but I'm 100% on board with it. And I think that
it's certainly an interesting market space, right? I think I have a story about that with HCG, and I've told you this story, right? That the HCG guy, the guy who discovered this, saw it as a natural phenomenon in the populations he studied, and thought that it could be a useful medication. The problem is, like you said, it's a biologic. HCG just exists within humans, and so you can't harvest it from humans. You get it from a different source, but essentially wasn't patentable, and so suddenly, like, or at least the formulation wasn't patentable, and so there was no value in this, and so they jailed the guy who was talking about it, right? And then he got out and kept talking about it. They jailed him again to keep him from talking about this benefit. And again, when the FDA basically says that something is banned, right, then you can't even research it, right? And this is the problem with cannabis, right? And cannabis's uses, and even any Schedule I drug.
Sure.
Trump I think really classified it, but go ahead.
Well, no, I was going to say, even like my husband always talks about how years ago, maybe it was in the 60s or 70s, like even some of these microdosing, some of these psychedelic drugs were like really helping people, right? Yeah. But then they had to ban them.
Yeah, they banned them. And so if they're banned, you can't research them. If you can't research them, there's no research dollars allocated to it. And so no researcher is going, because researchers have to get paid.
Sure.
And so they're not going to like look into these things. And so then they're just going to say like, well, they just don't work. That's why we ban them. And it's like, well, there's lots of things that don't do anything, but we still like take them. And you haven't it's always suspicious when there's I'm going to ban this.
I think there's always a backstory.
Yeah, there's always a backstory. And so peptides has entered the field here again, because is this something that is sellable? Is this something that is marketable or has money? And I don't mean money for the wellness clinic, money for
industry,
big pharma. Okay. And more importantly, money for insurance companies. Right. And so, especially when you're talking about wellness, again, insurance is in the business of denying your care. That is how they make money. I'm not saying that in a bad way. That is by definition what their business model is. And so I struggle with this a little bit, because they don't make money from your premiums. They make money from collecting premiums and not paying out.
Sure.
Right? So it's a weird formula. They could keep you healthy, then you would pay the premium, and then you wouldn't
need the
services. And so then they'd make money, I guess.
I guess they would make less money, right?
I don't know. This is the thing where I really would love to be a fly on the wall in these things where they've decided, let's keep people sick, but then also deny their care. They need to keep you sick enough that you feel like you need to pay for the insurance.
Yeah,
right?
Exactly.
Yeah.
Well, it's kind of like a scare tactic.
Sure. I mean, you're required, why do people keep car insurance? Well, so they're required by law to keep car insurance. And so now we have a law that also says you need to keep health insurance.
I'm curious, do you, back in the, let's say 80s, right? What did the health insurance marketplace look like? I mean,
doctors get a lot of, and I think that doctors dug their own grave here, okay? Insurance fraud was rampant.
Yeah. Okay, that makes sense.
And essentially, doctors for a while were paid in cash. There was a lot of cash pay services. And then insurance agencies rolled around, and doctors were like, oh my gosh, I can bill for this, and I can bill for that, and I can bill for this. And they got rich. And so the public still really remembers that, right?
Sure.
And
is that what led to all of these health insurance reforms, though?
Kind
right?
Of. Yeah. I mean, that's how they say it, right? They're like, we had to do this because doctors were rampantly fraudulently billing.
Sure. So, but now they've swung so far in the other direction that people are actually being denied for care that they really need.
Sure.
Or they make it very difficult for a physician to get that care approved.
Yeah, it became a slippery slope. They realized they could deny care and they could make more money by doing so, and then said, okay, let's just keep doing that.
Let's just stay the course.
Sure.
Padding our pockets.
Yeah. And so and there's still, the government still goes around saying Medicare fraud and all this sort of fraud, and that's the main driver of healthcare expenditures, when again, payments to physicians compromises only 8% of all healthcare expenditure.
Yeah. Like, so where is it? The Band-Aid that costs like $75? Is that?
Only 8% goes to that doctor. Okay.
Yeah.
Like, or doctor who put the Band-Aid on. Right.
Yeah.
And so like, what is happening? Right.
Yeah.
But I think that's a topic for another day.
Yeah.
I think I want to say, like, you know, I'll go back to my little question here that I had for you. It's like, what is optimization? What is care? Why does an insurance want to cover prevention, and why is the wellness space sort of erupting? We deal with this all the time. I lost the weight. I did all this stuff. Why does an insurance cover my skin removal surgery? Mm-hmm. It's going to help me not get infections.
Yeah. And they make it in the criteria. I'm sorry, I'm back on the thing. But the criteria is so difficult to get those people approved, right?
Yeah.
I don't know why insurances do it, right? But I mean, of course you know why, because they want money, right? Or they don't want to pay for something to make them whole again.
Correct.
Really.
Yeah.
It's something I don't know. Like, I don't obviously agree with it, and I have a hard time getting behind it. But in our field, it's particularly important. I mean, this is what we do. We try to make people whole again, right? After massive weight loss, after having a bunch of kids. And so I think that we're trying to give our patients the best opportunity to go into surgery prepared, right?
Yeah.
Physically and medically, right? So that mentally, after they have the surgery, they're like the process is complete.
Yeah, I mean, I think it goes one step further, right? I went to my medical school, my residency's motto was to make man whole, which is also kind of one of the plastic surgery mottos, right? It's like restoring form and function. That's like what plastic surgery really is about. And I think that almost all of medical history, even from like 3000 BC, right, was like, or 600 BC was like, something goes wrong and then you intervene. The system is designed that way and has always done so, because until something goes wrong, why would you go to the doctor?
Sure.
Does that make sense?
Yeah.
And so living a healthy life has really gained steam and traction, but it's sort of strange because doctors are not always being involved in these conversations, which is you'd think they'd be the people to do that.
Part of it. Yeah, I mean, like, I reflect back on my education in PA school. I think about we spent like no time on nutrition and really like disease prevention. It was all, the model is aimed towards treating disease process, right?
When something goes wrong.
Yeah, exactly. So I think it starts with our education, right? That's the way we're taught. And I think that, I mean, how many times, let me ask you a question. Yeah. When's the last time you went to the PCP for just a general checkup, just to make sure you're good?
Never.
Exactly.
Right?
Yeah.
Because we're believing these busy lies, and I'm seeing these reports of the colon cancer and all that sort of stuff, and you're like, oh my God, gotta get my colonoscopy because I could have colon cancer. And it's like, we as humans like really don't prioritize that, do we? Like, especially in America.
No, but I will say though, like the preventative care model, sometimes it does seem a little bit erroneous or like complicated, right? I go see my PCP. Okay, did you go get your mammogram? Did you get your pap smear? Do you want the script for the colonoscopy? Did you get this? Did you get that? I'm like, Jesus, when did preventative care become, like, I couldn't take that much time off to do all of these things,
Sure, but like we do it for our cars. Like, we're willing to do it for our cars. We go, like, the little light turns on, and it's like we need like a little light in our chest. It just turns on. Well, it's like you need heart maintenance.
You're right.
You need maintenance of some sort.
Yeah.
And you go and you take your car to get the maintenance. I mean, some people don't, but like, again, if you buy an expensive car and you want to take care of it, by God, if you spend a lot of money on that car, you're going to go to get the maintenance, right?
Yeah.
But like, oh my gosh, like, we only have one life to live, and people are, myself included, like not caring for a very valuable life. It's ours.
I look at my in-laws. Okay, they're 80 and 90 years old, respectively. Not on, I think my father-in-law's on one medication. He's 90. My mother-in-law, 80, no medications. She has prioritized their health from like their young adulthood, right? Like she does a good blend of Eastern and Western medicine. She's always been physically active. They've always exercised. Even a couple of years ago when he was 85, she was going to the gym with him like 3 days a week. And I look at them as such a good example of people who she like took it upon herself to really make that a priority and to make that a priority for her family. And you look at her and she's 80, but she looks like she's 65.
Yeah, I mean, she doesn't look at it at all. I would never known that she's 80.
And they're just a great example. But my point is that like she didn't just go to her PCP for that, right? She had to research on her own. She had to seek alternative physicians.
Because the PCPs are not like, it's even like the PCP is only one of the specialties, and even them, they're not focused on really preventative care. Like even when they go and they say, oh, this is heart prevention, this is heart disease prevention, it's still after your cholesterol is already bad.
Yeah.
Right? They test you, the cholesterol's bad, then they put you on the statin.
Sure.
So that protects you from the eventual heart attack. But what is keeping like your cholesterol from getting bad? Oh, we'll just eat healthy. Okay, well, what the hell does that mean? Right?
I mean, that is such a...
Okay. Yeah. Is the nutritionist covered by insurance? No. Again, just like the car, your car insurance does not cover your maintenance, your oil change.
That's such a good analogy.
And so it's like, so that costs extra money and investment, and some people obviously don't have it, right? But my point is not, and this is about the business of peptides, but like more importantly, it's like why are doctors and healthcare providers suddenly not part of this conversation, right? Like the same person who fixes your car when it breaks, even if insurance covers it, is the person who also performs the maintenance. You still go to the dealership, you still go to the oil stock, you still go to the person.
Sure.
In medicine, the doctors have gotten not doctors, I'm saying that as whatever, providers, healthcare practitioners, have gotten so wrapped up in the system that they claim to hate, and they're like, oh my gosh, the insurance company is like evil, but like they're still doing the thing that like the health insurance agency wants, which is only care about the disease once it's like there.
Yeah.
Right? And like, I don't know, like my vision with PCPS is that like healthcare should make people feel stronger, look better, be at a higher level, like live more fully before the damage happens. Like my life would be complete if like you did everything and you didn't need the facelift. Right?
Right.
Like that's the goal.
Sure.
Right? Like to put myself out of business is my goal. And yeah, I think I struggle with this idea of like we need to stop fixing broken people. We need to be revealing revealing whole ones, not make them whole, just reveal the wholeness that is already there and push medicine in that direction.
Sure.
And it might not be something that insurance is going to like support because that's not their business model and that's not the model of most of medicine. Not that there's anything wrong with that. Someone has to treat you when you break your leg or get sick or have a heart attack.
Sure.
But can we also do the other part?
I mean, I think that we are really trying here as a company.
Like we are?
Yeah.
Okay, sure.
I mean, I think we are. We've opened up the dialogue about, I mean, you brought up the peptides about 6 months ago.
Yeah.
And a lot of us were initially skeptical about it until we do research. And like, so I could be guilty of that, right? Yeah. Like I was like, no way, these aren't FDA approved. This sounds like voodoo. But I think we've opened up the dialogue. We're talking about it. We're ordering them. We're trying to do it in a very safe, like practical way for patients. And I mean, I think we're doing it with our recovery package that we offer our surgical patients. It includes preoperative nutrition, preoperative supplements. You know, we are making strides in our own small way that we can, but it is a foreign way of thinking.
No, I mean, it absolutely, right? Like, I mean, Carly, how long ago was that that post on the Journavix thing where I just got like death threats? What, how long? 2 months ago. Like we did the Journavix thing, right? And again, what's the problem? Those are people who already have chronic pain, who are already sick, seeking a solution. That's a different part of medicine, right?
Sure.
I'm sitting here and I'm saying, I want to introduce something that is going to have you not enter that state, right?
Sure.
And it's been complete, like, beyond my wildest dreams successful. I mean, we have patients that are coming into surgery having almost no recovery downtime, like no pain,
so
no
much
pills.
So that it scares me.
Yeah,
right?
so much
worried
so that
they're going to hurt
they're just
themselves.
like going at it, right?
Yeah.
It's just like they don't even. A patient just yesterday was like, I came in, I had no pain, and one day I got like a super swollen after surgery, and I came in, I got my IV, I got my lymphopress, I got my lymphatic massage, I took all the medications she gave her, the red light therapy, and then overnight, my body cleared it all. I lost 7 pounds. I didn't need any of the pain medicine. It did it. It worked. And it's like, yeah, but I don't have papers that prove it because there's no money in the research that proves those things, right?
Yeah.
And so those things, it costs money to do the research, and someone needs to fund it.
Yeah.
And so like you said, if it's a biologic, if it's a drug that doesn't have patentable capabilities, they're not going to look at it.
No, and to take it even one step further, I think that not all, but some healthcare providers are incentivized by big pharma, right, to prescribe things, right? So you're going to have a hard time convincing the majority, I think, of healthcare providers that these are good medications that can actually help people before.
Yeah.
Right.
And they might not even be aligned with that idea, so they're not interested in doing that. And and the reverse could be said about me, like, oh, you're a shill for like the organization. And it's like, again, I'll support it in the way that like I believe it. But I do think that as doctors, as providers, especially when we're licensed providers, the system is also is set up to constrain us, right? Because they know that we have a lot of power in a sense. And so the FDA wants to make sure that we don't go rogue. Because there are a lot of bad actors, okay?
Yeah.
A lot of bad apples, okay? No, not just because you're an MD or a DO or a PA are you like infallible as a human, right?
Sure.
And so, I mean...
Yeah, but I mean, like, to the public, people value our scientific opinion, I think, and that's a responsibility that we hold as healthcare providers.
Sure, and so it's a double-edged sword, right? If I start promoting something that I don't have a lot of evidence behind, and then I'm wrong, that loses credibility for the organization and for the public. If like your local influencer is like, oh my gosh, I love AOD 108 whatever it is, I forgot, like AOD, like again, if they're wrong, like what happens to them? Nothing. Like they don't lose their license, they don't get, and the funny thing is that in the past that is what happened. Again, this guy was promoting HCG, was not a doctor. The FDA cared very much because someone in the weight loss industry was gonna because of money, right? And they jailed him. Why aren't they jailing the influencers?
Good question.
Right?
Yeah, but they don't have as much at stake, I want to say.
I don't know. Maybe it's too widespread. Maybe there's too much, out there to do it. I think it's tough because I have, as providers, we have a lot to lose from a credibility standpoint, from a structural standpoint, from a business standpoint, if these things don't pan out. And then, but the public has so much to gain and the world has so much to gain if these things actually do work to keep us healthier. But the system isn't designed to. It's designed to constrain us.
Sure.
Right?
Yeah. I mean, it makes sense.
Yeah. I mean, again, there was bad actors for a long time.
I mean, I just think that anecdotally, like what we have done here, what we've managed to do over the past year really is, I think, when our recovery package really took off and when we started using Journavix and the supplements and stuff, anecdotally, it's just been, the patient experience is just wonderful. And I feel like our results are better, our patients are happier, our complications are down,
and I want to prove it, right? So that's why we started the survey. So if you have surgery here, we'll ask you to do a survey when everything's done. And it's not like, I really want to answer it honestly,
Sure.
like I want to know, can we prove that this is doing something? Because if not, we'll stop doing it, right? Because I'm still a healthcare provider and I want to make sure these things have value. But there has to be a way that we move medicine into that.
It's a challenge.
Yeah.
It's a challenge. And I will also say that a lot, like even naturopathic doctors, they go to I'm pretty sure they go to medical school, right?
You mean DOs?
No, NDs, naturopathic doctors.
They have a training system, yes.
Yeah, I mean, but like, I think that for a long time we've been told that these people are quacks, and I think actually now they're thinking that is not the case at all, right? Okay. And maybe they're on to this far earlier than we've been on to.
I actually disagree with you there. I don't think naturopathy necessarily has to do with it can intersect with prevention of disease. They still are seeking out, I have a diagnosis, I'm going to treat it as a naturopath. Right.
Yeah.
There is almost no system here. That's why they're inventing whole classes of this, like regen medicine, longevity medicine, like whole fields that didn't exist, because it's all about, like, what is the diagnosis code, Kristen?
Wanting to feel good,
alive,
yeah,
status alive,
healthy.
Right? If I want to get something approved by insurance, I have to put a diagnosis code, and then I have to put a CPT or treatment code, right? And so it's like, diagnosis code is healthy human. Okay, yeah. Well,
nobody's going to want to pay for that.
No one wants to pay for that.
Yeah.
I'm a healthy human. I would like to stay a healthy human. Yep. Nope. Denied. And so, but this is the future. This is what has to happen, right? Especially as we start getting, as disease processes get more elucidated, we live longer lives. We really start solving some of these problems. Like, okay, what happens after the cancer? Like, what if we cure cancer? What happens next?
Yeah. Then what? Some other chronic disease, right?
Okay.
Like, yeah.
But we like, that's all we talk about. Let's cure cancer. Is that what we're really doing? Is curing cancer like, okay, you got cancer and then we got rid of your cancer? Or is curing cancer like
preventing it?
Yeah. Making sure it never happens at all. I'm going to end there, I think.
I know, but it's, to your point too, like, I think, my undergrad's in dietetics and nutrition, though much of it I've forgotten, but
let's bring that back.
Macro, micro, mineral, nutrient metabolism. But I think that a lot of it's held in our food supply, right? Absolutely. And how we eat. But as I mentioned, like, I had the background, right? But in PA school and in medical school, did you really talk about nutrition?
Well, actually, I did. And I'll tell you why. I went to Loma Linda, and Loma Linda University for residency. Loma Linda is, when we've talked about this before, is the only blue zone in the United States. So people live longer, healthier lives. And so there's a huge focus on, like, living healthy lives and preventative medicine. And it says a lot that Loma Linda medicine really struggled to exist as a hospital. It was almost supported entirely by donations because they didn't make enough money because everyone was so healthy.
Yeah.
So we really struggled.
I always wondered about that because when you talk about your residency, I think, like, were that many people sick or did that many people need surgery?
Yeah, people just didn't need stuff because they were healthy, right? And so the hospital really struggled. And so it was based off a lot of donations. But the Adventist system is a healthcare system that was originally sort of designed around prevention of disease. And, what a far cry from where the Adventist system is now, especially in Florida. It's become an insurance company, and now it's insurance.
Yeah.
We need you sick so you pay for insurance, and then we'll keep you sick because we deny your care.
Yeah, exactly.
Yep. Something has to change. I mean, we're trying.
We're trying in our own little way.
In our own little way. Hopefully pick it up. Well, thank you everyone for joining us. I know that didn't cover a ton of peptides, but it is about the business of peptides.
Yeah.
We'll talk about it more later. You're a believer.
I'm a believer.
Join us next time. Thank you, everyone. How do we do it?